and tilt your head back at the end. So you're getting a pinching where? You can go down. Okay. So I mean, her motion is pretty good, and there's two ways I can get rid of the pinch. One of them takes a bit longer, but I think it works just as well as the second one. So the first way would be to fire diagonal extension patterns, which is, again, it's like firing the pattern, but without the perception of stretch or pinch in this case. So what I'm going to do is I'm going to push here, and I'm going to push here, so you're going to almost like just try to roll up this way, and then try to extend your hamstring. Okay, so let's do this a couple times, push. And this works really well, mainly for a end range pinch. It's not going to work that well for a mid range. Mid range, something else needs to be done, probably like ISTM or PDAs or something like that. Let's do this side. Okay. Try it again. My hips are a bit lower too. How's it feel? Okay.
Not as, I still feel it like across, but it's not as much.
Okay, now hold that top. The second way would be go all the way to the top. Good. Now just do diaphragmatic breathing. Give a big belly breath, and just give the same rules I showed before, like exhale slower and longer than the inhale, twice as slow. Hold the end of the exhale for about 2 or 3 seconds, and typically they can breathe away the perception of pinch. Or is it increasing?
It's more what I do now.
Okay. Then we won't do that. We might need to just do more extensions, but I think the extension also, it dropped your hips a bit. So you definitely felt the pinch less, but you went further. But you might just see what happens. Let's see what happens when you just do 10 press-ups, right? That might just help. Sometimes people also have the pinch when they roll up, and you want to make sure that they're not getting a pinch because they're firing their erectors. It didn't look like it. It looked like it was pretty passive. For those people, I want to say, just make sure you're using, your arms and your chest to push you up. So try not to fire this at all. Good. You tilt your head back. Still getting the pinch? Okay, that's fine. And that's, if it goes away, like you'll feel it now. Right. And if she was able to do 2 sets of 10, that's fine, with little entry into discomfort. That diagonal pattern works really, really well. But sometimes you can just change the pattern, like you go up in quadruped. Mm-hmm. So lock your elbows, and then just drop your hips forward, and then tilt your head back at the end. So you go into an extension, and then tilt your head back. How's that feel? All right. So you just change the pattern. Instead of doing, if they get, no, don't go all the way down.
I know, it like feels better to go into flexion.
I know, I would tell to a patient, if the directional preference was extension, everyone always wants to go into like a child's pose after, and I'm like, no, it's not to say that's bad, but we're talking plus ones and negative ones, let's just stick with the plus ones for now. And if you have to do that again, just do an extension afterward.